Monica Bellier takes her kids outside to offset all the time they're spending online for school. But how much learning is happening isn't clear.
There's a lot of setting up the tech, right? There's a lot of walking them through like, oh, well, try this or try that to get back online or get back into the worksheets. So because of that, I just don't see how it's possible that they're following the same curriculum.
According to a new UN report, pandemic school closures have resulted in a loss of, on average, 2/3 of a school year worldwide.
We are at risk of a generational catastrophe. And the global shift to remote learning has not served everyone equally in the world. Over 450 million students have been unable to access education.
Even wealthy countries like Canada haven't been spared.
This is a global crisis which is affecting children more disadvantaged because of their background, family background.
Sam Tekle is a professor and an education advocate for the Toronto neighborhood Jane and Finch, where he grew up. He says many children in the low-income area were reading and writing below their grade level even before the pandemic forced classes online.
We had in some ways to, at policy tables, be the voice to say, well, listen, there's so many families need devices right now. We need to figure out what we're going to do for high-speed internet. And then also we're thinking about families that have shift work, that immediately don't have access to immediate childcare.
Tekle would like to see the provincial government even the playing field for such communities in pandemic times or not. And UNESCO is urging governments, including in Canada, to make educational recovery a priority to help kids catch up so their learning loss doesn't impact the communities and economies that will one day depend on them. Sumanac-Johnson, CBC News, Toronto.
And the Ontario government hopes an increased use of rapid COVID tests will make it easier to get kids back inside classrooms. The Premier announcing the plan today, but there was no clear timeline.
To the parents out there, I hear you loud and clear. They're stressed.
Premier Ford said that along with deployment to schools, rapid tests will also be used in other high priority settings, including long-term care and retirement homes and essential workplaces. Well, joining us again, Dr. Susie Hoda, an infectious disease specialist with the University Health Network in Toronto. So, Dr. Hoda, clearly it's important to have kids in school, if at all possible, to do that safely. And secondly, rapid testing, at least in Ontario, seems to be the key to that. But when we hear that term rapid testing, what does it mean?
Well, I think that we're lumping it all together, but really there are two different types of rapid tests out there. There are those that are based on molecular tests, which actually perform pretty well and not that far off from what our gold standard testing is. And then there are these rapid antigen tests, which unfortunately are not as sensitive as we put it. So that means that you risk missing out on up to 30% of positive cases. The pros of these kinds of tests are they tend to be pretty quick in terms of giving you a result once you've collected the samples. And one of the major negative sides of it, though, are all the logistics that have to go behind the actual testing. So you need to have sort of an operation of people and a system in place to actually do the testing. And the throughput, unfortunately, because you have to wait for these tests to be done, when you're thinking about using this on a large scale, that can be a bit of a barrier.
So from your perspective as an infectious disease specialist, how do you feel about the link between some sort of testing and getting kids back in school in Ontario?
Well, there are two parts here, getting back into school and keeping the kids in school. So getting back to school, I actually think that the most important thing is controlling community transmission and making sure infection control in schools is optimized. When it comes to keeping them in school, testing is important. We absolutely need to make sure that regardless of what kind of testing is being used, there's access to rapid, accurate tests for people who are symptomatic while in school, and that's kids, students, or teachers, et cetera. And also for those who are exposed to COVID-19 cases. So we know exactly what we're dealing with and we can actually isolate people quickly. There are also talks about surveillance testing, and this could be useful in areas of high prevalence of COVID-19 when there's lots circulating around. It might be useful to kind of do sweeps across the school as long as it's feasible, acceptable to the kids, and all those logistics I talked about have been worked out.
You know, it's interesting. A lot of people I've seen across the country feel that rapid testing is kind of a simple answer to a lot of things. Sounds like it's more complex than that.
Oh, it absolutely is. And that's why we see different approaches across the country. People are still trying to figure out what the best use is for these different tests, and the fact that there are multiple different tests out there, not just one type of test. So, you know, it's a very complicated issue and not something you can just quickly summarize, I guess, in terms of what's the right approach.
All right. Dr. Hood, always nice having you on the program. Thank you.
Thank you.